implemented a very robust measure to ensure that there is absolute equity in the processing and settlement of claims, regardless of the facility tier, regardless of the location of that facility, and regardless of the type of facility. Is it faith-based? Is it private? Is it public? Honorable Speaker, I want to say that claims are strictly processed on first in, first out principle. This means claims are paid as they are received from facilities, ensuring that low-tier rural facilities receive the same exact priority as our national referral hospital. So I really want to urge, and we have talked to, through our clinics, facility owners, and we have trained them that how claims are lodged is not how claims were lodged under the manual fraud-invested NHIF. Claims are lodged through a digital system, a digital superhighway. Two, our data confirms, and hospitals have confirmed, this equity function is in practice. And today, the settlement rate across all levels in the country is at 74%. Within the 90 days that this House has allowed us in law. The law says we pay all our claims within 90 days. But we are more proactive. Every 14th day of every month, we pay claims. But our claim level currently at 74%. In fact, Honorable Speaker, I was with the leadership of Tenwek Hospital, and they told me the claims rate in that hospital now is at 80%. Specifically, the settlement rate for level 2 facilities stands at, as a primary health care, stands at 73%. Level 3 facilities stands at 73%. And this is directly comparable to the 72% settlement rate for level 4 and 5. And level 6, our referral hospital, both public, private, and faith-based, is at 74%. To support cash flow for management for our small and rural facilities, the Social Health Authority has implemented a strict 90-day claims payment rule, and if possible, even do the 14th of every month, further, which we have been predictably been dispersing at the 14th of every month. And that's why I said from last Friday to this Friday, we are disbursed, and we have disbursed 13.5 billion shillings. If you look at the collection of NHIF, they used to collect between 3.5 to 3.7. That collection was for 5-6 months. So we know what we are doing and what we are saying. Honorable Speaker and members, at the PHC, we have paid all facilities up to January 2026. And the balance is because of exchequer release. Once we get that exchequer release, we will pay February and March and April. We have received also an additional 6 billion, with 2 billion for maternity services, and the balance 4 billion is for other PHC services. Why am I saying? When we had the summit with the President, the Council of Governors, and the President at the summit in December, we have agreed in principle that there are certain dispensaries and health facilities in far-flung areas that are far from level 4 and 5 hospitals, and still our mothers deliver. That was not factored in the architecture of the Social Health Authority. Now we can serve our mothers in terms of maternity in the rural part of Kenya, and they can deliver at level 2 and level 3. Finally, since the inception of the Primary Health Care Fund, we have paid facilities. And this is something I think Honorable Speaker, Senators must hear. This is the transformation of universal health care under President Ruto. Primary health care in our dispensary and health facilities. Close to 8.7 million Kenyans have accessed free health care in all our level 2 and 3, and a total of 19.8 billion has been paid in 18 months. They will walk to a facility, there is a charter, it's walk in, walk out, you see a doctor, you go to the lab, you go to a diagnostics system, you go to the pharmacy, and you go home. In 18 months, 19.8 has been paid. In 18 months, 8.7 million Kenyans from all corners of our country have access. Today, the biggest source of revenue for our county governments is from the health sector. So, Honorable Speaker and members, the transformation undergoing in our country in the health sector under the leadership of President Ruto is real, is working, and Kenyans are appreciating across the country. Thank you.
Senator Hamida, any supplementary question?
No, Mr. Speaker, I don't have.
The Majority Leader.
Thank you, Mr. Speaker. I want to appreciate the Minister, a very hardworking